thank you for your time, and my name is Sophie Kang. I would like to thank Salary Baltimore and ETC about Foundation's warm support. Without this, I wouldn't be standing here today. So my name is Sophie Kang again. I'm the founder and CEO of Rehabtics. Rehabtics developed a telemedicine software system for physical rehabilitation using motion-controlled video games. Rehabtics was founded by a PhD student from Johns Hopkins University and outstanding professionals from Hunt Valley game industry. And the total experience of the team is over 50 years. So question, do you know anyone who had a stroke before? Either family, friends? Thanks. So as you may know, stroke is the #1 leading cause of long-term disability in industrialized nations. Stroke does and can occur in any age, from several months age old baby and to seniors. In the world every year, there are more than 50 million people suffering from stroke. In the United States, more than 7 million people have survived a stroke today. As we speak, every passing 40 seconds, there is a person suffering from stroke. The healthcare cost in 2008 for stroke rehabilitation is over $65 billion. The number is increasing at rapid speed because of the aging population and the greater prevalence of cardiovascular disease and obesity. Now imagine for a moment you are a stroke patient. As soon as you're resuscitated from the stroke rehabilitation intensive care unit, you will go through ICU, inpatient, outpatient. At the end of the 90 days, you will be released back to home doing years of home rehabilitation. There are many problems existing in this current process. There's no feedback, there's no guidance, and the process is very boring when you do self-directed home rehabilitation because it's composed of repetitive motions for hours every day. As a result, less than 33% of patients do follow home rehabilitation instructions, and they cost US more than $1 billion every year due to high readmission rates and the loss of productivity. That's where Rehabtics come in. Rehabtics is developing telemedicine software system for physical rehabilitation using motion-controlled video games. Our solution has 3 parts. First, we develop motion-controlled video games. We use Kinect camera and smartphone to track users' motions. And so we can enable users to do physical rehabilitation exercise in an engaging and encouraging experience. Also, patients' activity and movement parameters such as range of motion, velocity, speed is automatically tracked and logged in our system. So therapists can review their patient's progress and 24/7 remotely. Furthermore, therapists can give patients real-time feedback through texting, emails, and online video conferencing. When it's time to do physical rehab, you just need to turn on your TV monitor and your Kinect sensor, then you're ready to go. Our technology presents a low-cost, yet effective solution for long-term rehabilitation. We can improve patient experience and their recovery outcomes. For therapists, we can also enable them to track patients' progress and rehabilitation outcomes. Also, for hospitals and health insurance companies, we present a new way of decreasing their cost structure. So, when Rehabtics implemented in the hospital settings, we can reduce the length of hospital stay in ICU and inpatient, and we can reduce the number of follow-up visits in the outpatient units. Furthermore, Rehabtics can reduce the readmission rates, which is very critical for a hospital after the healthcare reform. We have 2 versions. One is home version using smartphone to track users' motions. And we also have a clinic version using Microsoft Kinect camera to track users' motions. Our business model is very simple. We do B2B, business to business. Our paying customers are hospitals, insurance companies, senior living centers, athletic training centers. Users only need to pay a basic licensing fee and a tiered pricing based on the number of users. These are the number of healthcare facilities we have identified which can use our system. Also, please note that Rehabtics is one of the patient monitor systems, which is an $8 billion market. And after the healthcare reform, the market is growing at 10% every year. So let's now look at the competitive landscape. The rehabilitation Right now, the market is focusing on the robotic-assisted rehabilitation devices. And many devices, the average price is about $200,000, and they're not fit for patients to use at home. The other two products on the market are Core TX and Hand Tutor. Core TX uses 1 degree freedom to track users' motions, versus Rehabtics can track multiple joints together in real time. Also, Hand Tutor is only focusing on the hand rehabilitation, versus Rehabtics can track whole body. Also, there is significant activity in the academic. Our more direct competitors come from 4 startups in similar stage as ours. And especially, 1 of them is from Canada, 3 of them come from US, and 3 of them all get venture capital investment early this year. So I know you may be asking, why patients don't simply use Wii or Kinect commercial products on the market? The answer is because these solutions, the movements inside these solutions are too complex for patients to use. We have an outstanding team. I'm a PhD student from Johns Hopkins University, and my research focuses on the rehabilitation field. Also, the other 5 team members from Hunt Valley, each one of them have 8 to 18 years industry experience. And here's my team member Manju, and so he's also from Hunt Valley. And also, we also have outstanding advisory board. Our clinical board comes from expert and leading researchers from Johns Hopkins University, Johns Hopkins Hospital, as well as University of Maryland School of Medicine. Also, we have a very good advisory board from senior entrepreneur in the rehabilitation field to healthcare IT analytics field. So we have very experienced advisory board as well. So Rehabtics was founded in October 2012 after we win Johns Hopkins Business Plan competition and awarded National Collegiate Innovator Alliance grant. And since then, we have been making great progress in our product development. We're wrapping up the beta version at the end of this month, and we have several pilot testing have been lined up to test it on our products on real patients. And also in May this year, Rehabtics was selected as one of the finalists for Maryland Incubator Company of the Year 2013. So our pilot testing, we already secured several agreements from local stroke associations. And we're going to carry out pilot testing in June and then the second one in August this year. Right now, we are negotiating with several leading hospitals, such as Johns Hopkins Hospital, MedStar Good Samaritan Hospital, and we're trying to reach out to Department of Veteran Affairs to negotiate contracts. Rehabtics is projected to reach positive cash flow next year. Thank you. So we are seeking $600,000 to $800,000 for technical development and improvement. So this fund will enable us to implement several critical functions, and also will help to improve our data analytics and as well tracking algorithm. So Rehabtics is developing telemedicine software for physical rehabilitation. And our value propositions for patients is that we can improve their recovery outcomes. And for healthcare providers and payers, we can provide them a solution to reduce their healthcare cost. And we aim to become the market leader in virtual care and telemedicine. And if you're interested, please stop by my booth there and I can show you demos and we can talk further. Thank you very much for your feedback.